As we've been trying to get a handle on this pandemic and what the near future of it might look like in the States, we're going to take a look abroad and take a look at the situation in Italy as that nation becomes the epicenter of the coronavirus in Europe. Now, the entire nation, it's under a strict quarantine, and just about everything is closed besides food stores, pharmacies, and limited businesses. Now, the hospitals, they're also struggling, to say the least, just to try and get a handle on this crisis. They're running out of beds, forcing doctors to basically do triage anywhere that they can find space. And we're even seeing reports of funeral homes not coming to pick up bodies for people who die at home. So what we wanted to do was get a firsthand account of what is going on there. And for that, I want to bring in Dr. Fabio Zattoni. He's an MD at the University Hospital of Udine in Italy, and he's also my first cousin. Doctor, let's start off by first looking at a picture of a nurse who collapsed from exhaustion at a hospital in Cremora. How overwhelmed are the medical staff there?
Well, yes, this is a real picture of how bad the situation is, especially in North Italy. This photograph actually became a symbol of overwhelmed medical staff, doctors and nurses. Coronavirus has overloaded our healthcare system. There are no more shifts, there are no more hours. Social life is suspended for all of us. There are no more surgeons, urologists, radiologists. We are only doctors who are part of the same team on front line. Italy is facing is a version of nightmare. It didn't take too much to completely saturate our capacity to provide care for these patients. The cases are multiplying every day.
I understand, doctor, that respirators and supplies in hospitals are in short supply. Also, we have government guidelines that have been issued to the Italian hospitals that have been issued that border on wartime catastrophe medicine. Doctors, nurses, you're being forced to choose which patients to treat. It sounds like Italy's dealing with war.
Try to imagine that right now, if we get 10,000 people in Italy in need of ventilator, when we have only 3,000 in the country, means that 7,000 people will die. Doctors are being forced to prioritize younger coronavirus patients over older people with pre-existing conditions. And the younger people have the greatest chance of survive. It is the fact that we have to choose. Not to mention that there is a great disparity between the number of available hospital beds in Italy. I mean, there is a huge difference between the welfare north and let's say, the poorer south. So what the main concern is, if Lombardy is so much under pressure, the outbreak in the south could be really catastrophic.
The rest of Europe, we're being told, Fabio, is they might be a week away here from Italy's reality. We see some scary projections in Germany. And America, it possibly might not be that much farther behind those. So how should leaders spend that limited time before your reality becomes theirs? And how should they prepare their publics here for what they should expect?
The rest of Italy right now is like where Milan was 10 days ago. As you may know, in 10 days, there has been incredible escalation. I am afraid that other European countries are heading this way if they do not rapidly. Our Prime Minister Giuseppe Conte placed nationwide restrictions on internal movement and public gathering. He ordered people to stay home and seek permission for essential travel. These restrictions serve to reduce as much as possible the number of occasions for contagion. People in Italy are being first in Europe to face strict measurements to contain the virus, such as staying home, no sport events, no traveling, unless for emergencies or essential work-related purposes. The borders with the surrounding countries are closed. Shops, restaurants, schools, and universities, museums, and gyms are closed across the whole country. Honestly, we are facing an incredible economic damage caused by the virus. We were being honest from the very beginning about the number of tested people and of those who turned out to be positive. We are sending this message to give our experience to the world, to give you the time to prepare. Unfortunately, this is a chance that we didn't get. Scientists and researchers should cooperate during this crisis more than ever to understand the disease.
Fabio, thank you, and good luck to everyone in Italy. Up next, the coronavirus is taking a huge bite out of the economy. Now, the R word, recession, is being thrown around as almost a certainty. After the break, we'll explain how this is impacting business and also ordinary people just trying to earn a paycheck.